Let's talk about one of the most frightening symptoms a person can have, chest pain. It's a total puzzle, right? And it sends millions of people rushing to the emergency room every single year. So today, we're going to unpack how doctors piece together the clues to solve it.
You know that moment, that sudden pressure, maybe a sharp jab or a weird burning feeling right in the middle of your chest? Your mind just leaps to the worst-case scenario. But what is that signal really trying to say? Let's dive in.
Pretty much everyone's first thought is heart attack, but the reality, it is way more complicated than that. Look at this. While serious heart problems are a big piece of the pie, a whopping 42% of cases are actually gastrointestinal. We're talking things like acid reflux, and that's not even counting all the other possibilities, from muscle strain to inflammation. So here's the bottom line. For you and for your doctor, the #1 challenge is sorting through all those possibilities, and fast. It's kind of like a high-stakes investigation, trying to figure out what's truly life-threatening versus what might be less urgent but still needs to be figured out. Okay, so where do we begin? Well, like any good detective story, it all starts by gathering clues. And in the case of chest pain, the most critical clues come directly from you. The story you tell, how it feels, where it's going, what makes it better or worse, that's the launching point for the entire investigation.
But here's the thing. Not all clues are created equal. Some parts of your story are way more telling than others. For instance, if the pain travels to your right arm or shoulder, that makes a heart attack almost 5 times more likely. Same goes for pain that spreads to the left arm or shows up when you're exerting yourself. These are major clues.
Let's put these side by side. On one hand, you have the classic high-risk clues, that feeling of pressure, like a squeezing sensation, pain that radiates, and stuff that happens when you're active. Then, on the other hand, you have clues that point somewhere else entirely. Pain that's sharp and stabbing, gets worse if you poke the spot, or is stuck in one tiny area. It's a world of difference.
So, with all these different clues floating around, how does a doctor make sense of it all? They don't just guess. They have a playbook, a structured way to organize all this info and actually calculate the risk. And one of the most powerful tools in that playbook is something called the heart score. Seriously, just think of the heart score as a detective's 5-point checklist. It's brilliant. H is for history. That's the story we've been talking about. E is for ECG, that electrical map of your heart. A is for age. R is for your risk factors. Things like smoking or diabetes. And T is for troponin, a super important blood test we're about to get to. This score turns a jumble of symptoms into a clear, understandable risk level. All right, the patient's story gives us the leads, but every good investigator needs some hard forensic evidence, right? Some definitive proof. That's where the troponin blood test comes in. It can give us a direct look at what's happening to the heart muscle itself. So what exactly is this troponin stuff? Well, imagine it's a protein that's supposed to stay locked up tight inside your heart muscle cells. But if those cells get damaged or die, which is what a heart attack is, troponin leaks out into your bloodstream. Finding it there is a huge, very specific red flag that the heart has been injured. But, and this is crucial, a single troponin test doesn't tell the whole story. The real key is the trend over a few hours. This flowchart shows it perfectly. If the troponin level is high and it's dynamic, meaning it's going up or down, that points to an acute injury happening right now. But if it's high but stable, that suggests something more chronic is going on. Yep, the pattern is absolutely everything. It's like the difference between a single photograph and watching a video of the event as it happens. A rising troponin level is like watching the injury unfold in real time. That's why, if you're in the ER, they'll often take blood more than once. They're looking for that change. So, let's recap. We've gathered the clues from the patient's story, we've used the heart score to quantify the risk, and we've analyzed the forensic evidence from the troponin test. Now, it's time to put it all together and crack the case. And this is where it all clicks into place. You can see how these different sets of clues point to completely different culprits. If you've got pressure radiating down the arm, a high risk score, and rising troponins, the prime suspect is myocardial ischemia. But what if the pain is sharp, feels better when you lean forward, and the blood tests are normal? The doctor might suspect pericarditis. Burning after a big meal points to reflux. A tender spot you can press on? Probably costochondritis. See how it works?
And that's the whole process. It's this methodical combination, listening to the story, using a score to assess risk, and getting the lab tests that turns the frightening mystery of chest pain into a clear diagnosis. You go from this wide-open uncertainty to a specific, actionable answer. So now that you've seen the playbook, think about this for a second. If you ever have to deal with this, How can you be a better witness to your own body? Knowing which details really matter, the quality of the pain, the location, what triggers it, that can help you give the exact clues needed to solve the puzzle, faster and more accurately. What is your pain trying to tell you?